Welcome to Politics Done Right. I am your host, Egberto Willies. This is a progressive program that will take the mystery out of politics. This is the program that will encourage you to make sure government becomes we the people. Whether you are liberal, progressive, conservative, or otherwise, you get to air your point of view. We are an independent media outlet that, unlike mainstream media beholden to corporations, we only owe allegiance to you. Remember, you can also send me a tweet at EGBERTOWILLIES. That is at Egberto Willies. Let us engage. It is Politics Done Right. Folks, welcome to one more edition of Politics Done Right. I'm Egberto Willies, your host. Thank you so kindly for being a part of the show. Before I get started, I am touched. Patrick Magner, two great holiday supportive gifts, donations to Politics Done Right, right there on the screen. Thank you so kindly, my brother. Appreciate you. Appreciate your support for what we do here, which is very important work. And if it weren't for people like you, we really couldn't get this done. Magna, thank you again for your support. Anyway, folks, welcome to another edition of Politics Done Right. Let's give Patrick Magner a huge hand for giving us a great contribution to start 2026. And 2026, we have a whole lot of work. So thank you so kindly, my brother. Thank you so kindly, my brother. All right, welcome aboard. Welcome aboard. We've got in the house AVQ to start the day. We also have, he says it's been a long day listening from AFK. All right. Eric is in the house from Kingwood, Atascocita. Michael Rudden is from Brooklyn, New York. We have Joe from California, in Los Angeles, California. We also have Eric in from Atascocita, Kingwood. Yvette Avery Herod from Atlanta, Georgia. Henry Denson in from Missouri City, Texas. Thank you for being here. Of course, I'm late on the Substack because it starts up late, but thank you so kindly for being here. Marcia Hotchkiss, Patricia Nowlin, Stephen Hogan, Sindig, Gail Farley, Do You Lie? Anita Poe, Angie Decadence. I love that name, Decadence. You know, it's like doing something you're not supposed to, but the food is so good. Thank you for being here, Angie Decadence. Jerry Stout is in the house. And of course, we have Lee the Bearcat from Austin, Texas. Welcome aboard. Welcome aboard. Anyhow, we're going to have a great show for you today. You know, earlier today in my morning show, I'm not going to read it here, but I'm going to repost it. I hope to get it cleaned up. And not cleaned up, but posted it on Substack. It's an article that I wrote 12 or 13 years ago about a certain year worth. And while I'm not going to go over, Egberto, enjoyed listening to you and the rest of the panel on the Rethink week with attitude on the attitude with Arnie Arneson. Yeah, I taped the tape with Arnie on Friday, and actually today I also tape on Mondays with WBAI in New York. I did it one with Jenna James. What's her name? Jenna. Anyway, I always get the last name makes Halligan. So I taped with her and with Arnie on Friday. So yeah, I've been doing a whole lot of work on other radio stations as well. A few other radio stations are starting to carry Politics Done Right. Again, like I said, this is all for the cause. All of my material goes over to these stations absolutely free of charge, because I think more than anything else, we need to be sure that we get the message out. Welcome aboard, Marnie and Elwin Hudson. Welcome aboard, Adeline Fucillo, Barbara Wells, Bob Moorhead, and Wilma Scott. Anyway, I tell you what, let's just go ahead and start that way. I'm going to start with, I don't see that Michael brought up any shorts for today quite yet. So I'll go ahead and start with the piece that I did in New York with Jenna let me go ahead and find that interview, and I'm going to play it as soon as Jenna Flanagan. I can never remember her name, None today is what AVQ says. None today. You're slipping, AVQ. I'm kidding you, AVQ. I'm kidding you. Let's go ahead and get the one that I did with Jenna Flanagan in a minute, as soon as I can cue this baby up. I want to make sure that I map that in, and then after I map it, where is it? Jenna Flanagan. Oh, that's mapped in already. Here we go. Para ver. Here we go.
They gave you high prices. They gave you the highest inflation in history, and we're bringing those prices down rapidly. Lower prices, bigger paychecks. You're getting lower prices, bigger paychecks. We're getting inflation. We're crushing it. And you're getting much higher wages. I mean, the only thing that's really going up big, it's called the stock market and your 401ks. That's going up. But I say, and I said it the other day, and a lot of people misinterpret it. They say, oh, he doesn't realize prices are high. Prices are coming down very substantially. But they have a new word. They always have a hoax. The new word is affordability. So they look at the camera and they say, this election is all about affordability. Now, they never talk about it. They never talk. Thank you very much. They say I'm not allowed to run. I don't know what the hell that's all about, but that's okay. They said 4 more years. You see the new hat? We have 4 more years. 2028. We've also said. But under Biden, real wages plummeted by $3,000 a year. Under Trump, the typical factory worker has already seen their wages increase by more than $1,300, and that's in just a few months. And for construction workers, it's $1,800 up versus $3,500 down, and I think their number is wrong. It's much lower than that.
All right, that was President Trump speaking last week at the Mount Airy Casino Resort in the Poconos in what was supposed to be a speech on the economy, but diverged into a freewheeling campaign-style rally. So here to discuss some of the other major developments of the week, including Secretary of Homeland Security Kristi Noem walking out of her congressional hearing, are our regular panel. Washington, D.C. correspondent Dave Leventhal, political reporter, and veteran Laura Jadid, and Egberto Willies, host of KPFT's Politics Done Right. Welcome, everyone.
Thanks for having us.
Egberto, according to a survey released last week by the Associated Press, the Newark Center for Public Affairs Research, only 31% of U.S. adults approve of the president's handling of the economy. And that's down from 40% in March. So we weren't talking high numbers in the first place. His lowest numbers of any point in his second term, basically. So do you have a sense of what is driving this precipitous drop in support for President Trump's economic agenda?
Absolutely. Actually, that drop is coming mostly from independents, and now it has finally hit the MAGA base. As Laura pointed out, everybody can go to the store and see that the prices are getting higher. But I think there is some additional context that the mainstream media has failed to point out. They give context a lot of times to what Donald Trump is saying, right? They point out several price raises, etc., that occurred under Biden and use that as an excuse to compare the Trump price increases that are really caused by tariffs and immigration attacks on workers. The issue really is that if we went ahead and did the numbers, we would actually find out that these increases in prices are not due to true economic issues. If you take a look at why prices have gone up, they've gone up because of corporate greed. Nobody's saying for there to be price increases, there has to be something called shortages. And we have not had shortages that justifies the increase in price. So what we have is economic fraud and the American people. And as long as we keep it into this Biden price rises versus Trump price rises, we have really missed the real issue, which is corporations are making a killing on us based on a fraudulent economic system.
Gotcha. Egberto, how concerned do you believe the president and his staff are with some of these polling numbers? Like, are they bothered? Are they brushing them off? Are they dismissing them? Like, usually we see White Houses follow these numbers very closely and adjust policy and speeches accordingly, regardless of what they might say publicly. Do you think that's happening here?
I don't. I think the ones in the know, they're concerned. Unfortunately, the ones who has his ear aren't the ones in the know. So I think they're living in a land where they know that they think their voter suppression is going to work. The Supreme Court is going to help them getting rid of VR2, the Voting Rights Act, which will allow them to be as draconian as possible in places like Texas and Florida, etc. The problem is, Jenna, I don't think Republicans understand how the people have soured against MAGA. But as it turns out, his people are concerned, a few of them, but the ones that have the Donald Trump ear, they are not concerned because they're oblivious. They believe the Supreme Court is on their side, so the voter suppression will be just fine. They believe that that as far as the red states are concerned, they have enough. The swing states are all that they think they have to mess with, but those guys are starring as well. What I tell progressives and otherwise going forward is the victory has to be very overwhelming. And what is interesting is that is what we're seeing. We're seeing swings of 10 to 20 something points throughout. That cannot be solved with voter suppression. That cannot be solved with looking through rose-colored glasses. They are in trouble. They'll find out a couple of months before the election.
Wow. All right. Well, there's so much more to talk about, but unfortunately, we are going to have to leave it there. So I want to say a huge thanks to my panel, political reporter Laura Jadid, Egberto Willies, host of KPFT's Politics Done.
They gave you high prices. They gave you the highest inflation in history.
Sorry about that. I had to cough and mess with my click and all that good stuff. But by the way, Lee the Bearcat, you caught me. I almost called the wrong Jenna. You know, it's funny because that name popped up in my emails for some reason today. You know, so wow, you guys listen to everything that I say. Wow. Lee the Bearcat. Okay. All right. Michael has a short. I hope it's a good one, Michael. That's not going to get me in trouble. I'll go ahead and play it and make sure you don't get me in trouble, Michael. Let's see what we got here. You know, we like interaction from our people. I love this guy. Boy, that's 27 minutes, Michael. I can't do that. What is that? Did you give me the wrong thing, Michael? Yeah, got 2 minutes after your say. That says 27 minutes. You probably got me the wrong click. So when you get a chance, fix that for me and then I'll play it for you. All right. Oh, only the first 3 minutes. Okay, I got you. Okay, if it's only the first 3 minutes, we can actually do that. Let's go ahead and do that. Cue that baby up and go ahead and do it like that. Let me cover my face for this one. And let's do it this way.
Wife Michelle were tragically murdered, and right-wing influencers wasted no time in reminding us all what really matters, their own moral superiority. This is how I would paraphrase a lot of the early posts from online magas when this news broke. They're like, vultures on the left, take note. While I was no fan of Rob Weiner's politics or his movies, though I did like the one where that badass general gives a speech about how beta cucks like Tom Cruise secretly worship us alpha males and need us to be violent so that America's awesome. Still, I didn't like Rob Reiner, but I would never be disrespectful in a moment like this. Even though disgusting liberals celebrated Charlie Kirk's death, I promise you, you won't see anyone on the right mocking or politicizing this horrible murder. And then right after that, the person at the very tip top of the American right both mocked and politicized this horrible murder. Imagine that. Yeah, and an insane, even for him, post on Truth Social, Donald Trump said that Reiner's death was a result of Trump derangement syndrome. That he was so obsessed with Donald Trump that it drove others into a literal homicidal rage, which, aside from the fact that that sounds like Ben Shapiro wrote a Law and Order storyline, that has some truly unsettling notions baked into it. Like, the sitting president of the United States just reacted to the violent death of a Hollywood star who opposed him by basically saying, you know, he'd probably still be alive if you like me enough. Let that be a lesson to you all. If you don't like me enough, someone will eventually stab you, and it will be your own fault. So presidential. Yeah, y'all think he tweeted that from the same desk FDR used to sign the New Deal? Or look, to be fair, this was so out of pocket that even a lot of his staunchest supporters are balking at it. Like in the comments of the post itself, a lot of people are being like, look, you're my favorite American of all time, sir, but this is a bit much. Like, MAGA all the way, but this is beneath you. This isn't like you, Mr. President. Okay, look, I'm glad y'all realize this is wrong, but I'm not going to have y'all acting like this is weird, okay? Like, oh, the world's most malignant narcissist just made the most malignantly narcissistic post in social media history. Inconceivable. Like, don't act like this is some rare misstep from an otherwise great man, okay? Like, no, this is pure distilled Trump right here. Like, this is your guy. Hell, this is why he's your guy, and it's why America's in such trouble right now. Like, this post, this moment, this is the whole thing. Y'all, it's a perfect snapshot, all right? It is like all those many moons ago, y'all saw this loudmouthed egomaniac being boldly ignorant, proudly hateful, and unabashedly selfish on the biggest stage, and you thought, I'll have what he's having. And now, almost a decade later, the cultural and political division have gone up to 11 in this country, and you love it, and you love him for doing it. You're his number one fan. So
I love Trey Crowder. I love this guy. This guy is really, he's a comedian, but he always has his hand on the political pulse. Thank you for that, Senor Rudnin. That was a good one. Yeah, what the president is doing to make the way he has reacted to that murder on Rob Reiner. I mean, how could you? How could you? It is amazing. Anyway, we got a lot more to cover. I have another video, but before I get to the video, what I really want to cover is some stuff on healthcare. As I spoke to the group this morning, to our audience this morning, effective January, hell's going to break loose for a lot of people. And I want to warn people here. A lot of people are sitting back saying, well, the people on the exchange, it's only about 6% of Americans that are on the exchange. But that 6% of Americans represent over 20 million people, right? And that will be damaged by the healthcare crisis, the lack of subsidies. And here's the thing. A lot of people think only those people who get subsidies are going to suffer. That is far from the truth. Our economic system is a closed system. If one particular group suffers, we exchange the suffering for all of us to give wealthy people a huge tax break. Don't ever forget that. And for those who think, well, the middle class isn't going to be touched, it's a closed system. Here's the deal. The money already went to the wealthy. They got their stuff already. They got their stuff. What has happened now is that who has not received their stuff are those that are going to receive subsidies. But since people are going to get sick, whether they have insurance or not, and since we still have a modicum of humanity in our healthcare system, not a lot, but some, all those sick, uninsured people are heading to your closest emergency room for healthcare. All those people without insurance. And guess what happens when that occurs? When that occurs, they are not going to pay the bill because they don't have insurance. Yes, some of them will lose their homes. Some of them would lose many of their cars, etc. But all of you that are listening to my voice right now, whether you have employer-based insurance, your own private insurance, or whatever, all those prices are going up Because the people that never lose are shareholders in the aggregate and the executives. They price themselves profits first. They price themselves profit first, and then they do the calculations as far as what to charge you. I mean, it's business. It's business. Look, when I was in business, when I was pricing ComDRV, etc., yeah, I had to determine what's the minimum profit that I wanted to receive, right? That's what you do. What's the minimum profit that I wanted to receive? And based on that is how you price your product. Now, I've told you guys a lot of times, being sort of I guess a crazy person. There are a lot of times I would price things and then feel guilty about pricing things a certain way because I ultimately knew that the corporations would pay whatever because they're going to pass the bill right on to everybody else. Patrick says disproportionately small business owners are on the exchange and cannot absorb $30,000 annual increase in coverage. No, they can't. Look, the woman that I'm going to play next, right? This woman, her insurance is going to go from $400 and something a month to $2,000 a month. She's 64 years old. I want you guys to realize that one woman is going to pay $24,000 next year to the insurance company. $24,000. Make this make sense for me. She has other friends that work with her who has the same bill. They have decided to forego insurance. You know, they're betting that they will not have more than $24,000 in medical bills. This system is evil, people. This system is evil. This is evil. But anyway, let's go ahead and play her before I go into the next subject, because since I brought that up, let's go ahead and play that. And then we'll go ahead and talk about the Common Dreams article. Let's see. Here we go. Aquí está. Vamos a comenzar. In 15 days from today, if you're watching this later, maybe another time, but in 15 days from today, the subsidies to the Affordable Care Act, Obamacare, expires. And it's going to cause a lot of pain on a whole lot of people. I want you to listen to this piece here. This lady's healthcare has gone up by 4 times, 400%. She has 1 year to go to Medicare traditional, but at least she's going there. She has to bite the bullet for 1 year. 1 year, $24,000 for her health care. $24,000 as a gift to the insurance company. If she is lucky enough to stay healthy, that will be just $24,000 given away to the insurance company. Our healthcare system is a fraud. And the more and more people find this out, they will get off this bandwagon of wanting to have private health insurance. And it is a fraud. Let's go ahead and listen to this story, then we'll finish on the other side.
My next guest is one of the millions of Americans whose monthly premiums will balloon if the ACA subsidies do expire at the end of the month. Right now, Ellen Allen pays $479 a month for her health care coverage, and she just learned it's going to cost her almost $2,000 starting in January if Congress does not act. Joining us, Executive Director of West Virginians for Affordable Healthcare, Ellen Allen. So you're just outside of Charleston, West Virginia.
Yes.
Tell me about the healthcare plan you are currently on.
Hi, Katie. Yes, thanks for having me. I am on a bronze plan, and I currently pay, as you said, just under $500 a month. It also includes vision and dental care. It's a bronze plan. You know, it has higher amount of coinsurance, but I've been happy with it. The same plan without vision and dental, because it went up so much, will cost me almost $2,000 next year. And that's about 320% increase. And then you calculate an additional maximum out of pocket and co-insurance, you're pushing over 400% increase. So, and I'm not the only West Virginians that are looking at exorbitant increases in the coming year.
What are you going to do?
Well, I've been planning for this. We do this work all the time. So that's what we've been working and educating West Virginians about the entire year. So I've set up my own health savings account just to squirrel away some money so I can do that. I'm 64 years old. I don't want to go without health insurance, obviously. So I'm just going to have to foot that bill. I'm fortunate in that our organization helps pay a stipend to our small staff, but still it can't absorb all of those costs. So it falls on the individual, as it will over 67,000 other West Virginians in the state.
Congress yesterday voted on 2 bills. One of them was an extension of the ACA subsidies for 3 more years. That was a Democrat-backed bill. The Republicans voted on a bill to deposit money directly into health savings accounts, I guess like you've opened up for yourself. For you, because you're over 50 years old, it would be $1,500 directly into that account. Wouldn't be able to use it to pay for your premiums, but any other healthcare expense. Did you have a preference for one of those plans?
Yes, I would like to see the 3-year extension. And in that time, hopefully our lawmakers could get in a room and do some real work on addressing the affordability of healthcare. Look at site neutral payments, look at what's driving the increase in healthcare costs, which is really hospital costs. I look at price transparency. So that's what we prefer. And, I think the HSAs, I think that's illustrative of just how out of touch our lawmakers are. Not only could that $1,500 one-time payment, that's not even per month. It's a one-time deposit into an HSA. And there are some tax benefits, but, when people's health insurance premium is $2,000 a month and upwards, and again, the maximum out of pocket pushing $10,000. It's almost laughable. Again, that shows how out of touch they are. You have to have high amount of disposable income for the HSAs to really benefit your household.
The Republicans say the ACA is terrible. They have real problems with it. They've not liked it since the beginning. They say it's really vulnerable to fraud and that it doesn't work. What's your experience with the ACA, Ben?
Well, they've had 15 years to fix it, and they've come up with nothing better. I think, frankly, it's an extraordinary achievement that has reduced the uninsured rate around the country. Could it be better? Of course. Addressing the costs of hospital costs, again, site neutral payments being a big issue. That's something lawmakers should get together on and address. In West Virginia, prior to the ACA and Medicaid expansion that came about at the same time, West Virginia had close to a 20% uninsured rate. Since the ACA came into law, that rate is below 6%. Now, that's an extraordinary achievement. And many people in the industry think when you get around 5%, you're really speaking of functionally practical full insured rate, because there's always going to be some people that, for whatever reason, don't want to be insured. But the insurance is very good, and it truly does give affordability and access to every single American.
What are the folks you work with going to do?
Well, I know one person who is not going to have healthcare coverage. She just can't afford it. When we've been going around the state in our cuts and consequences tour, and people ask us, what do they do if they know they can't enroll because of the high premium costs? They're going to FQHCs, free and charitable clinics. And West Virginia has a really good network of free and charitable clinics and FQHCs. But if you have a catastrophic event, chronic illness like cancer, you're in a car accident, you're hospitalized, that's where you have to depend on your healthcare coverage.
Now, you heard what she said. She put some money away. She had the disposable income to put some money away to cover what's going to happen to her, the $24,000 that she's going to have to give the health insurance company for herself. But here's the deal. You notice she also said she has friends that work in the office that they will simply be going without insurance. They'll have to find free clinics. They'll have to go down to the level of, my God, I never thought I would be here. But let me tell you what's so dramatic about what's happening, people. And this is the shameful thing about what's happening. Earlier today on my program, somebody came on and said, or a video that one of our PDR Posse members showed us, actually showed that the military folks voted for Donald Trump 60-40 against Kamala Harris. In other words, 60% for Trump, 40% for Kamala Harris. Who was going to maintain their benefits? They also that's the military. Now, that meaning the veterans. We also have the farmers who voted overwhelmingly for Donald Trump. Cost them $44 billion. Of course, Donald Trump is going to give them back $12 billion of the $44 billion that he screwed them over with tariffs and money to Argentina, etc. But look at what he's going to harm in healthcare. Look at the people that are going to be most harmed. Here on the screen, I've just placed the states that will be affected the most. Tell me what you find in common. Texas, Arkansas, Louisiana, Mississippi, Alabama, Georgia, South Carolina, Tennessee, Florida, Arizona. What's special about these states? Iowa. All these states, predominantly for the last few sessions, have been voting fairly red. And those are the states most affected. States not all that affected, blue states, Oregon, California, New York, Maine. Okay? Let's be clear, folks. Donald Trump, with his policies, while they think they are giving it to the libs, while they think they are, screwing the libs, what Donald Trump has done was, for the most part, hurt more intensely the people that voted for him.
All of our country's problems, from polarization to ignorance on domestic and international issues.
And absolutely so. And this is what a lot of people don't realize. Now, it's funny because if you're on TikTok, Instagram, Telegram, and these other networks, short networks that promote a lot of shorts, YouTube shorts, you start to see a whole lot of MAGA coming on. I didn't know they were going to do this to me. The model Latinos, the model Republican Latinos thought they were immune. So all these Cubans in Miami and elsewhere, they had all this salsa music going. Yo voy a votar por Trump. Voy a votar por Trump. And they had all these music, and it was amazing what they did for the Cubans did for Donald Trump in Florida, right? And then, to their surprise, Donald Trump is purportedly lifting the special immigration status that Cubans get. So Cubans going to be like any other third world country people trying to get into the United States or being deported out of the United States, because when these statuses are revoked, a lot of Cubans are going back to Cuba. It is amazing. What is so amazing is how this guy simply shows, I don't care. He simply doesn't care about anyone. The guy is a supremacist. He simply doesn't care. Now, here's the other thing that he did, right? They claim that they want to get more of the United States workforce involved in our healthcare and in everything else. Well, here's the truth. If you take a look at the policies that this president is supporting, let me get to Margaret. Hello, Margaret. How you doing, beautiful?
I'm doing well. How are you, Egberto?
I am doing fine. Talk to me, sis.
I just wanted to kind of put out a few facts. When ACA was approved, originally they wanted a public option along with it. And Lieberman, Democrat, who turned independent, was spearheaded, and he said no because of lobbyist insurance companies. Now, if that would have happened, we would have been in better shape, because who can provide good insurance? I mean, health insurance is the government, public. The insurance companies are just greedy, and more greed. When you have an insurance pool with more people, the premise is your prices will go low. No, insurance companies saw, hey, let's just squeeze them dry. So that's all I have to say. And those people who say, well, ACA caused all this inflation in healthcare. It's multifactorial. They can't say that. We need to extend the subsidies till we can get our together enough to get Medicare for all. Period.
Let me go.
End of story.
Don't leave yet, Margaret. Here's the thing that back in 2009 and 2010, while this stuff was going through the rigors, and when Lieberman, first of all, we did have the public option. It was all there. And Senator Lieberman said he would not vote for it. He would not give it cloture if we went ahead and put the public option. I wrote several. At that point, I was a senior editor at Daily Kos, and I wrote several times that what I love about that, even as the ACA wasn't going to give us exactly what we wanted, Margaret, the good thing was that public option, because there is no way the private sector could compete with the public option. They would have had to do some magic, because the math just isn't there. There is really no real purpose for health insurance. There's none. There's no reason to have private health insurance. None. To pay a bill? Please. There's no reason for private health insurance. I mean, and for people who said, well, you get choices. No, you don't get choices. You get a chance to see which corporation you want to screw you. That's all. That's the only choice you got. But anyway.
Period. End of story. I totally agree.
Absolutely.
Agree.
Thank you so kindly for your call, Margaret. And thank you for listening as well. All right.
You're welcome. Anytime. Thank you. Bye-bye.
Thank you, sis. Bye-bye. Yeah, Margaret nails it. Look, since, I love when my callers call in and simply change the things that I was going to talk about. But I want to talk about what Margaret called in about. The public option was, I call it a trick, right? We would have a hard time getting Medicare for all. But if we had a public option inside of Obamacare, that immediately, I remember when we were talking about that, I immediately said, okay, I will compromise and keep and support the policies of having private insurance if we have the public option. Because the bottom line is the public option would have killed private sector healthcare. And it justifiably should have. Because if I had $1,000 worth of bills, and I told you, and I said, okay, John, or okay, Margaret, I'd like you to provide a service to me. The service that you're going to provide to me is to pay my bills for me. And you say, okay, Egberto, I'll pay your bills. And then the government comes and say, hey, I can pay your bills too. And I start to look at both of them. And I say, Margaret, how much are you going to charge? Well, you say, well, I have to pay for advertising. I have to pay for the databases that keep all my clients together. I've got to pay for all the doctor, all these things you have to pay for. And then the government says, well, we got a database already, and we don't have to pay bonuses. We don't have to pay shareholders. We don't have to pay any of that. And you know what else we don't have to pay? The doctors now don't have to deal with 10 different companies. They don't have to hire people to deal with 20 companies, 30 companies to decide what insurance you have. It says all of that's gone. So guess what? To pay your $1,000 bill to different companies every month, I'll charge you $3. And then you come and you tell me, okay, well, $30. And you come and you say, well, Egberto, I'll charge you $30 or even $300 to pay your bill. That is what private health insurance is. Taking a lot of your healthcare dollars that should go into paying the bill and paying it to shareholders, paying it to executives, giving bonuses, buying advertising. None of that. If the government is responsible for paying the bill, none of that needs to be paid. None of it. It's not rocket science, but they have so fooled us into believing that the private sector is more efficient that too many people have bought the crap. And it's hard. It's hard when people have been so indoctrinated. If you listen to the morning show, I called one of the callers later, and I said, look, I really want to talk to you about this because we need to get this taken care of in one's head. The capitalist system cannot work, will not work. It's impossible to work for healthcare. And we are proving it because we're living it. It's impossible. It's mathematically impossible. You know, inflation rate, let's say between 2 to 3%. But people that are investors expect to make more than 2 to 3% year over year on their investments. And healthcare in the capitalist market is just another investment, which in the aggregate tells you that they have to raise their prices by 7-8% a year to satisfy their shareholders and their executives. Or if they don't raise their prices, give you less service. In other words, deny you coverage. And that is exactly what they do. They do both. They raise the prices higher than inflation, and they deny you service. This is our fault, people. We can go and tell our Congress people, you will effect Medicare for all. You will sunset private health insurance, but you have to tell it overtly. You can't go half in and half out. You can't be half pregnant. You have to tell the private insurance company, your days are numbered. You're out of business. You have failed. You have failed. You know, I mean, I don't know how you came into existence in the first place. Let me tell you better. I want to stay on this subject because I want to show you how corrupt it is. Insurance companies are into giving you insurance for profit. That's the deal. They're in for giving you insurance for profit. Okay. We always knew that if you're doing something for profit in the healthcare domain, you simply cannot do it for a reason. If I break my leg, I don't have choices. I need to go to the quickest hospital to fix me up. I don't have choices to shop. And if I don't have choices to shop around, the market forces don't become effective. So therefore, the only sane system is what every other industrialized country does. Okay? And that is, it has to be the government provided in some form or the other. You got to take the profit motive out of that. And let me give you how exact this is. Remember, the government, the private sector would not insure old people. They wouldn't, because old people get sicker. So old people used to have to go without insurance. Old people used to have to go without insurance. Okay? As a sensible nation, what we did is we said, okay, from the time you start to work until you stop working or until you stop earning income, we are going to take out 3-point-something% of that money and put it into Medicare. So absolutely everybody that has a job everybody that makes income, everybody that has stock appreciation, everybody pays 3-point-something% in Medicare taxes. Now, the rich people even found a way to get around that, right? They don't, when they sell their stocks, they don't sell their stocks. They borrow against their stock. So they don't make any income purportedly, but they can still spend a lot of money. But let's leave the rich people for a while. Now, everybody pays 3-point-something% in Medicare taxes. And since the government collects all of that, they made a pact with all of us that when we retire, we get Medicare. It wasn't the best because there's still 20% that they didn't cover, which we need to cover, but you had to still buy private insurance to cover the last 20%. Some people just don't buy that gap. They just go ahead and get the care and they let whatever that 20% go ahead. And there are a lot of doctors that would go ahead and say, I forgive the 20%. Okay? But what happened? The parasites, the insurance companies then come around and say, wait a minute. We could not afford to insure old people. But since the government did the job for us and collected the money from the time these people were young, let's go to the government now and we'll say, hey, government, why don't you let us administer Medicare for you however we want? Give us a fixed amount of money for every Medicare person we take away from the government, and we'll pay the bill. So now that the government has collected the money, that's Medicare money, the insurance companies now, through this concept called Medicare Advantage, do not take Medicare Advantage. It is a fraud. The insurance companies say, the government already collected the money. We can now go, since we couldn't collect the money, it was too expensive for us because, this money is now collected from the time the people were born, started working. So now we can take that money from the government and we can make even more money. And that's what Medicare Advantage is. Medicare Advantage used the government to collect money that they otherwise couldn't collect from because everybody is in the pool. And now that everybody is in the Medicare pool, these private insurance companies now come in and take the money out of the pool and use some of it for profit. And our government, we the people, elected thugs who allowed that to occur. What that means is that we have allowed the private sector to rape the Medicare fund with Medicare Advantage. We don't want them to run Medicare Advantage. We want to keep traditional Medicare and make all that money go to health care. When you pay Medicare Advantage, that money doesn't only go to health care, it also goes to what again? The shareholders of the insurance companies. It goes to the database. It goes everywhere. People, it's a ripoff. And there is nothing honorable about it. It's just saying, please, you have a license to steal from us. Medicare Advantage is the license for the private insurance company to steal the money from the Medicare fund. Okay? And what do? The same crap that they do with private insurance that Medicare folks never had to worry about. If you were on Medicare, look, you have everybody just waiting to get onto Medicare when they reach a certain age because they know all the crap that they had to go through with private insurance companies was no longer there. If a doctor said you need this medicine, that's what you got. If a doctor said you need this surgery, that's what you got. If a doctor said we need to go ahead and do this test, that's what you got. No pre-authorization or any of that crap that these companies use as a method to deny you service. But if you go to Medicare Advantage, now everything has to be pre-approved. Now you got to decide. They'll tell you what medicine you can and cannot have, whether you must use generic or not. the same corruption that they did with private insurance is what they brought to Medicare with Medicare Advantage. Medicare Advantage isn't Medicare. It is private insurance for old people. That's it. And the same ills that you have in private insurance is what you got. Brothers and sisters, this is our doing. And what I'm saying is, going forward, the reason I write a lot about this, I talk a lot about this, we have to elect the right people who are going to be honest and not fall for the bribes from these corporations. We are going to have to elect progressives left and right in this 2026 election. It's not about electing incumbents and all of that. It's electing people who make the commitment for Medicare for all. And when I say Medicare for all, I mean we can do away with traditional Medicare. We can do away with Medicare Advantage. We can do away with private insurance if we just have Medicare for all. Collect the same way we're collecting just Medicare taxes. Collect Medicare for all taxes, and it covers absolutely everybody from birth until death. It's not difficult. And we take the private sector out. Let them go ahead and rip people off in other domains. Let them go rip people off who have the choices to decide if they want to be ripped off or not. When you go to a pizza shop, if that pizza is too expensive, you have the choice to walk out. When you break your leg, that choice is not there. When you have certain types of cancer, that choice is not there. Well, that's not true. When you have cancer, if you try to get to Kettering, but you have Medicare Advantage, forget about it. They'll tell you, I'm sorry, we are not taking that insurance. We don't take Medicare Advantage. And every single year, more and more of these hospitals and clinics that take care of people, every year, the amount of them that take Medicare Advantage is dwindling. It is in our hands. And I am not pessimistic at all. I'm very optimistic that if we get our job done, if all of us who have a platform, if all of you share the platform, we can actually get the job done. It's not going to happen on TV at all. TV is paid by the drug companies. You remember today I spoke about that $2.1 million drug per dose on my morning show, a drug that was developed by our tax dollars, a drug that was developed by charity dollars, and the drug companies are selling it for $2.1 million per dose. This is insane. But it is insane because we have allowed it. So let's take responsibility, do the work that's necessary to go ahead and elect progressives, but I don't mean any progressives. Progressives who made a commitment to make the change. Medicare for all, the only option. Medicare for all, the only option. The only option. And folks, let me tell you, and now this is self-serving. They're not, our mainstream media cannot do the job. It's not that there aren't good reporters. There are damn good reporters at ABC, CBS, NBC, CNN, and even Fox News have some good reporters. But they can't do it. In a capitalist society where your news is controlled by the capitalist companies, they can only go so far. It is all left to us. It is all left to the private sector. It is all left to independent media. We are the ones who have to convince enough people throughout this country to vote appropriately. And for us to do that, we have to be funded. And I want to give a big thank you again right now to brother Patrick Magner. Patrick just gave us a very healthy contribution to support the program. Thank you, Patrick. I just have to say thank you. But what we need right now, folks, are a lot of paid subscribers. So if you're not a paid subscriber, it's a coffee. Please consider becoming a paid subscriber. If we are to get this message out, I tell you, and I'm going to spend 2 minutes on this and then I'm going to go because we're out of time, but I have to do this. The right. I went out with a MAGA guy on Sunday. We had coffee with Egberto and a MAGA guy. And this guy had all the Trump's paraphernalia, the MAGA hat, he had all of this stuff, right? And I'm saying, look at the amount of money this guy invested in the MAGA movement. They are successful not because they're popular. They're successful because they support the movement. We should be supporting Politics Done Right. We should be supporting Marlon Weems. We should be supporting Arturo Fernandez. We should be supporting those of us doing this kind of work. I know it's self-serving, but it's the only thing that's going to get us through this. So I ask all of you to go to politicsdoneright.com/newsletter, politicsdoneright.com/newsletter if you're not on Substack, to become paid subscribers. If you're already on Substack, just go ahead and donate. Just click that subscribe button and subscribe with the option to become a paid subscriber. But I'm going to put that link in there right now, the politicsdoneright.com/newsletter. Please consider subscribing. We cannot do this without you. All right, folks. I am interviewing Congressman Al Green on Friday. I don't know if I'll have it ready for the show, but definitely by Monday. Al Green is coming on. We're going to talk about whether he's going to switch districts to run, et cetera, et cetera, et cetera. So we'll talk about that. But we have a whole lot of stuff planned for 2026. We are going to do our part to inform and ensure the right people get voted in 2026. So please, again, go support us, become paid subscribers, and also do whatever you can to contribute to the movement. Love you all. You can write me directly at info@politicsdoneright.com. My name is Egberto Willies. This is Politics Done Right. And you guys know how I end this baby. I am what? Out!
All of our country's problems, from polarization to ignorance on domestic and international issues to a complete misunderstanding of our economic and healthcare systems, are a direct result of a derelict mainstream media that too often bend over backwards to support corporate or bought politicians' wants as opposed to the people's needs for real information to make their lives better. Independent media is the only solution to inform truthfully and factually. Why? Because our loyalties are to you, the ones who fund us with small dollar contributions and subscriptions. Please consider supporting our independent media platforms by subscribing to our Egberto Off the Record newsletter at politicsdoneright.com/newsletter. Again, that is politicsdoneright.com/newsletter. It's an investment that pays incalculable dividends.